Medical surgical nursing is the basic backbone of all nursing practices. This practice began as an entry-level position for all nurses and has since changed to a separate specialty similar to oncology or pediatrics.
Being a med-surg nurse involves many rigorous duties. They must be able to provide care for patients with multiple diagnoses that cover numerous specialties. They must also understand complex differences in medications. Ultimately, they must be multifaceted, structured, and patient-oriented.
The medical surgical nurses must be able to assess patients, administer medication, encourage activity, prevent complications after surgery, and provide general care for patients both before and after their procedures.
Medical surgical nurses must be able to manage multiple patients as well as new admits and discharges. They must be knowledgeable in all aspects of adult health and place patient safety in their top priority. They must be able to support their patients and families as well as care for all ages and work as a team.
The most common setting for med-surg nurses are in inpatient care units, urgent care centers, surgery centers, and much more. It is in these settings that they apply their wide range of skills to give quality care for their patients.
Hi everyone, my name is Caitlin Black. I am interviewing Lacey. She has been a nurse for 8 years and a med-surg nurse for 2. So, how did you get interested in med-surg nursing?
When I finished nursing school, I really felt like I needed experience to help me in my career. I really wasn't interested in being an emergency room nurse. So I really kind of felt like med-surg was really the place for me to gain the knowledge I needed.
How did you train and prepare?
Really the biggest thing was nursing school is what helped me to prepare. I was lucky in the fact that the hospital that I went to work for ended up and allowed us to have up to 12 weeks of training with a one-on-one preceptor on med-surg. I ended up and completed 6 weeks of that. They felt like at that time that I was prepared and was able to go on my own after that. So that really helped a lot too.
What was your favorite part of your job?
Definitely dealing with the patients. I feel like that's what I got into nursing for, was being able to work with the patients and show them that I care and that I was there for them during one of the most difficult times in their lives. So that to me was the most enjoyment that I had.
What was your least favorite part or what was most stressful to you?
Med-surg can be stressful because you've got so many different disease processes going on with different patients. All in one shift, you can be dealing with someone who has cardiac issues. You could see someone with respiratory issues. Someone maybe who's having gallbladder issues. I mean, it's just there's so many different things that you can see. The patient acuity and the number of patients that you have can be difficult at times, especially if you've got patients who have a lot of things going on. So that can be pretty stressful on you. And trying to keep everything on track and knowing where you're supposed to be and what's going on with each patient. You have to be pretty prepared and really know how to prioritize things.
Out of your other nursing professions, was being a med-surg nurse more or less stressful or about the same?
I really believe that any type of nursing that you go into is stressful. It may be stressful in different ways. Med-surg was a lot more about the patient care with the stress, wanting to make sure that you were doing the right thing. You didn't maybe mess anything up. When you go into management, to me it's a different kind of stress because then you're not only, worried about the patients, but you're worried about the staff underneath you as well and making sure that they're doing what it is they need to do. So I really believe that all type of nursing is stressful. It just can be different ways.
Can you use the skills that you learned as a med-surg nurse for other nursing professions?
Definitely. To me, med-surg was a great building block for me. I was able, like I said before, to see so many different aspects. You know, working with someone who maybe was an alcoholic and going through withdrawals in med-surg, you know, some of those type of things that they have going on kind of helped me with doing psychiatric nursing as well. Now that I'm in the nursing home setting, um, you know, doing med-surg helped me with IVs, tube feedings. I mean, to me, med-surg is a great way to gain the experience that you need for other nursing.
Um, Out of the nursing values that we talked about during the value paper, which do you feel is the most important, or like a combination of all of them when you're a med-surg nurse?
I really think it's a combination of all of them. You know, I feel like if you've gotten into nursing for the money, then you're definitely in the wrong profession. You need to be compassionate, you need to be caring. You know, you're seeing people and their family at their worst times. You know, so it's you kind of need to understand that um, people are not always going to be nice, patients are not always going to be nice, but you have to be compassionate, you have to be caring, you have to be in it for the right reasons. Um,
Would you recommend that a nurse go into med-surg after nursing school?
Definitely. My 2 years really, I feel helped me a lot. I had the option coming out of nursing school, basically just about any job position that was open that I was pretty much interested in. I applied and I interviewed, and a lot of the jobs, you know, they offered me, but when I got the med surg position, when I was offered that, that was the one I decided to take because I just, again, I really felt like that was the experience that I needed, especially in the beginning of my nursing career to help me to move forward.
And lastly, what advice would you give anyone going into med-surg?
I would say to always ask questions. Don't be afraid to ask questions. You're especially coming out of nursing school, you're not going to know everything. And you're going to have questions about different procedures that you've never seen before, different medications. I know a lot of time they say that nurses eat their young. And I think that can be true in a lot of cases, but my advice would be not to let that bother you, just to keep asking questions because really, truly, even as a nurse, you know, 10, 20 years down the road, you're still not going to know everything. You're still going to be asking questions. And I think that's okay because the healthcare field is always changing. There's always going to be a new medication out there, a new procedure. So just asking questions and performing continuing education. I mean, that's really the best way to keep informed.
Okay, well, that's all the questions that I have today. Thank you.
Thank you.
Bye.
Come in.
Hey, I'm Courtney. I'm going to be your med surg nurse today, and I'm going to take your blood pressure. Looks good. Okay, another nurse will be in here in a minute to get your vital signs, and then you're off to surgery.
All right, thanks. Come in.
Hi, I'm Julia. I'm here to check your vitals before operation.
Okay.
Now, if you could step forward for me, please. And breathe in. And out. And in. And out. Okay, now I'm going to check your pulse. Okay, everything looks good, and your surgeon and anesthesiologist will be in soon to talk to you about what's going to happen. Okay.
Though medical surgical nursing can be very difficult at times, it can also be very rewarding. Many nurses choose to use med-surg as their introduction into the nursing field after graduating from nursing school, meaning the occupation provides the means to learn a wide variety of skills that they will continue to use throughout their entire nursing career. Medical surgical nursing can be stressful and demanding, but all fields of nursing are the same way. The stress and time management skills obtained while working as a med-surg nurse are very helpful and will always be useful during a nurse's career. Working in med-surg and taking in the mandatory skills will allow a nurse to always put her or his patient first, no matter the field or circumstance.